Welcome to CardioPharma Tips series. Today we are discussing an interesting question regarding medication, which is before or after meals. The questions that we usually ask ourselves: what's the problem if medications are taken with foods? The first problem is that food itself may act as a physical barrier to drug absorption, limiting its bioavailability. The second problem is that acidic medium inside the stomach after eating may interfere sometimes with drug absorption. And the third problem is that certain components of food may result in chelation of the swallowed drug and so reducing its absorption. That's why most of the doctors advise the patient to take the medication either 1 hour before meals or 2 hours after meal in order to enhance its absorption and optimal drug delivery, and so enhancing its bioavailability and its action. But this is not always the case. Some of the medication may need to be taken with meals, and it is essential not to be taken on empty stomach, because sometimes the acidic medium inside the stomach may act as enhancing the absorption of specific medications, the opposite to the common belief for the most of the medications. And certain medication may be directly irritant to the stomach, and so this effect will be reduced by eating, and that's why some of the medication we need to advise the patient to take it with meals. Of course, we cannot give a complete list in this video, but we can see some of the examples of the cardiac medications that we need to give with foods. The first example is aspirin, which is a COX inhibitor resulting in antiplatelet effect, commonly to be prescribed in all ischemic patients. Aspirin itself is directly irritant to the stomach, plus its inhibitory effect on the gastroprotective prostaglandins. That's why it may result in gastritis, and so most of the doctors advise the patient to take aspirin with food and plenty of water to avoid gastrointestinal effects. Another famous example is rivaroxaban, which is a famous example of non-vitamin K oral anticoagulant by inhibiting factor 10. And the administration of rivaroxaban, especially for the 15 and 20 milligram doses, enhances the absorption and bioavailability, and so it may reach more than 80% if it is taken with meals. The relation to food is not affecting the 5 and 10 milligram doses, plus also the 2.5. So here, it is not important to take with food, but for the large doses, we need to advise the patient to take it with food in order to enhance its therapeutic effects. Evapo Protein is a funny medication acting on the funny channels NSA node, and so it is used for weight control in heart failure, coronary artery disease, and inappropriate sinus tachycardia. Here, the administration with food may slow down the absorption by 1 hour, but as a net result, it increases systemic absorption by 20 to 30%, and so it enhances bioavailability, and it is advised to tell the patient to take the 2 doses of Evapo Protein per day with foods in order to reduce any variability in systemic exposure and so enhance its therapeutic effects. The last example in our video today is Metformin, one of the classic and first choice oral antidiabetics in many cardiac patients. The problem with Metformin is that it is directly irritant to the stomach, resulting in gastritis and GIT upset. And so it needs to be taken with meals in order to reduce this upset, which may result in reduced compliance with the medication. And so it's important to advise the patient to take it with meals. Of course, there are much more examples in each specialty for medications that need to be taken with meals, but here we were getting some of the famous examples of the medications that we commonly prescribe in our cardiology practice. So the conclusion of our video today is that most medication need to be taken either 1 hour before meals or 2 hours after meal, and so we need to give the instruction clearly to your patient about this. But there are some examples that need to be taken with meals, like aspirin, rivaroxaban, Evapo Protein, and Metformin, because here it results in higher bioavailability and less GIT upset, and so we need to give clear instruction either in one of these 2 cases that you should take it on empty stomach or you should take it with meals. Thank you very much for watching this video, and wait for the next video in CardioPharma Tips series.